In an ideal world, every IVF doctor would treat the patient with respect and make sure that they had realistic expectations of IVF treatment. At the time of the consultation, they would review the diagnosis with them and prepare a treatment plan. They would also explain what they were planning to do, how much time this would take, and what the costs and risks would be. This would ensure that patients are prepared for what was going to happen, because IVF treatment takes time, money, and energy, and patients need to organize their finances, leaves, and work commitments. That's why it's important that they have realistic expectations as to how much time, energy, and money they will have to invest in the process. IVF is elective treatment, and this is something which is very easy for every clinic to do. Now, the doctor should also explain why they've chosen a particular treatment plan and what they will do to monitor the cycle to make sure everything is going well, what the checkpoints will be, and how they can correct for this so patients know exactly what is going to happen and when. Patients hate unexpected surprises, and this openness and transparency is in the doctor's best interest because it creates trust in the patient. Because the patient knows what is going to happen, they feel they are in control rather than feeling helpless, lost, and confused. More importantly, when patients know what is planned, the chances for error go down dramatically because patients become active participants in their treatment. Sadly, most IVF clinics don't bother to do any of this. They modify treatment on the fly, and everything is very disorganized and unsystematic. They don't share information with the patient, who often has no idea as to what is going on. They don't provide a treatment plan, and it seems that the treatment plan changes all the time depending on who the doctor on duty happens to be. It often seems like the left hand doesn't know what the right hand is doing, and the poor patient is clueless and lost. Are things going the way they were supposed to? Is the response good or bad? They only find out there is a problem when the cycle fails, when the doctor reviews the records with the patient and comes up with all kinds of excuses, pretexts, and reasons for why the cycle failed. The poor patient feels cheated and wants to know why this information wasn't shared proactively before the cycle was started. They want to know, why are you telling me this at the last minute? But they don't have the guts to express their displeasure. Our advice is simple. Learn to be proactive and assertive because you are the one who will be spending a lot of money on your treatment. Ask for all this information up front. This is your right, and you don't need to be aggressive either. The doctor is not doing you a favor by providing this. You have paid for his services and have a right to know. If the doctor is rude and refuses to answer your questions and treat you with respect, then you are definitely in the wrong IVF clinic. You need to find a better doctor who will treat you like a respected, intelligent adult.